Morning, Katie. My name is Kelly Effinger. I'm your nurse practitioner for today. I'm going to be assessing several different systems on you, starting with your head. I'm going to be looking at your eyes, your ears, nose, mouth, throat, your neck and thyroid, and as well as your cardiovascular system and your respiratory system, okay? It's going to involve some different positioning. If you're ever uncomfortable or if you need to stop, just let me know, okay? So first I'm going to take a look at your eyes. Your eyebrows look evenly distributed with hair. They're symmetrical. Your eyes also look symmetrical. Your irises and pupils are round. Your pupils are about 4 millimeters on both sides. Now I'm going to take a look, pull your eyelids down, look at your conjunctiva. It's pink and moist. Very good. Not the top part. It's also pink and moist. I'm going to do a couple vision tests on you, okay?
Okay.
First, I'm going to ask you to look at this handheld chart. Hold it about a foot away from your face.
Okay.
And read, try to read this very bottom line to tell me what you see.
Okay. 3.
Oh, actually, you know what? I need you to cover one eye first.
Okay.
Okay, now read left to right this bottom line.
372-646 WN, then a backwards E, X0031 plus.
Very good. Now let's try it with the
Okay.
other hand. Very good.
372-646 WN, side backwards E, X0031 plus.
Very good. Your vision is 20/20. You made 0 mistakes, which is perfect. Alrighty, now I'm going to test your ocular, how well you move your eyes, okay?
Okay.
So you're going to look at my finger and just follow it with your eyes only, not your head, as it moves. Okay, back the other way. Okay, very good. I didn't notice any kind of nystagmus. I noticed just nice smooth movements from side to side, which is normal. Now we're going to test your peripheral vision, okay? So I need you to cover one eye. I'm going to cover mine as well. And you tell me when you can see my hand in your peripheral vision, okay?
I see it.
Okay,
I see it.
good. Now we're going to switch into the other side.
I see it. I see it.
Okay, very good. And right when you saw the hand was right when I saw the hand, so our peripheral fields match each other, which is normal. Now I'm going to have you do a little test. I need you to find a point on that far wall,
Okay.
and focus on it. Keep looking at it. Keep looking at it. Now I need you to look at my finger. Okay. This was a test of convergence. What's normal is that your pupils will constrict when you look at an object close up, as opposed to far away, and yours did. So that's normal. Also, what I'm going to do here is check your pupil's response to light. So I'm going to place my hand here on your nose, and I'm going to shine a light on your eye. Look straight ahead. Okay. Now the eye that I shined the light on constricted, and so did the other one. It matched it. So that's normal. Let's try this eye. Alrighty. That one constricted. Let's try one more time. And then so did the other one. So passed. Now last thing I'm going to do with your eyes is to take a look inside of. Try to just focus straight ahead. Okay. And what I noticed in there right away is I went in, I saw a red reflex, which is normal. I also saw your optic disc, which is kind of a creamy yellow to pink color. I noticed your blood vessels in your eyes. Everything looked normal. And the last thing I noticed was your macula. It's kind of a spot, a darkened area in the center of the back of your eye, and everything looks good there. So I'm going to check out your other eye. Okay. And same thing here. Saw the red reflex, saw the optic disc. It was kind of a creamy yellow. And lastly, I looked at the macula. Everything looks good. So now we're going to move on to your ears. I'm going to take a look at the outer structure of your ear. Any tenderness as I'm pulling and
No.
pushing? Okay. What about with this ear? Any tenderness?
No.
Okay. I don't notice any excess of earwax or discharge, which is good. Going to do a couple hearing tests. This first one is called the Weber test. I'm going to place this on your forehead, and you're going to tell me which side you hear it on, okay?
Okay. I hear it on both ears.
Okay, that's good. That's normal. Now I'm going to do what's known as the Renee test. I'm going to place this behind your ear. You let me know when you can no longer hear it.
Okay. I can't hear it anymore.
Okay. Can you hear it now? Tell me when it stops.
It stopped.
Okay, very good. So on that ear, the air conduction was longer than bone conduction, which is normal. Now we'll try the other side. Can't hear it.
I can't hear it anymore.
Okay. Can you hear it now? Tell me when it stops.
It stopped.
Okay, good. And same finding on that ear. Air conduction was longer than bone conduction. And I'm also going to do the whisper test. So I'm going to stand behind you about 2 feet. I need you to occlude this ear with your finger and kind of wiggle your finger around. And I'm going to whisper a couple of words back here and you repeat them for me, okay?
Okay.
862.
862.
Very good. Now occlude the other ear and I'll do the same thing. 179.
179.
Very good. You got them right. The last thing I'm going to do with your ears is to look inside of them. Okay, you let me know if I'm causing you any pain or discomfort.
Okay.
Alrighty, on this ear I see the tympanic membrane. It's kind of a pearly gray color. The borders all look intact, and I see the light reflex as well, which is all normal. I didn't notice any excessive earwax or any kind of discharge. Take a look at this eye, or this ear, excuse me. Ready? Okay, same thing over here. Kind of a pearly gray in color. The borders all looked intact on this ear. However, on the upper part of this ear, I am noticing just a little bit of scar tissue, kind of whitish scar tissue. Have you ever had tubes as a child?
I did.
Okay,
Yes.
so it may be from that. But otherwise, it looks intact, and I also see the light reflex. So you're looking good there. Okay, I'm going to move on to the nose. Okay, I'm going to press these over your sinuses. These are your frontal sinuses. Any tenderness here?
No.
Okay. What about here, your maxillary sinuses?
No.
No. Very good. Okay. And your nares look symmetrical. Septum is right down the middle, so that's good. Okay, and now I'm going to take a look up into your nares. Okay, your septum appears to be patent. Everything looks nice and pink and intact, and that is what we want, so that's good. One more thing, I want you to occlude one side and take a deep breath. Okay, same with the other side. Okay, good, you're getting nice airflow through both. Now I'm going to take a look at your mouth. Your lips look symmetrical, intact. I noticed just a little bit of cracking and dryness on the corner here. Can you smile for me real big? Okay, all your teeth are present and intact. Now I need you to open your mouth for me. Stick your tongue out. And go All right. Your uvula rises as she says which is normal. One more time. Okay. Her tonsils are about 1+. And now I'm going to look at the inside lining of your cheeks. And it all looks pink and moist and intact, no lesions. Now the upper, the roof of your mouth as well. intact. Can you lift your tongue up for me? Okay, go ah, lift it up.
Ah.
There you go. See the bottom underneath your tongue, your frenulum is intact. Then move your tongue to one side. Okay, now I'm going to continue looking at the sides of your tongue. Move it to your one side. There you go. And now the other. And up when you look underneath. There you go. Okay. Now it looks good. Now I'm going to take a look at your neck here. Palpate the trachea. Feels like it's nice and midline. I'm going to come around the back and feel for your thyroid. Okay. Kind of displacing it to one side while feeling the other. It feels nice and smooth, no nodules. Same on the other side. And around the front. Can you swallow for me? Okay, and I felt it rise and fall. Once again, nice and smooth. Okay, clear. Any tenderness as I was pushing?
No.
Okay. I'm also going to palpate here for your lymph nodes in different areas. Here's your preauricular, your posterior auricular, your occipital, your tonsillar, your submandibular, your submental, your anterior cervical, the deep cervical chain, your posterior cervical, and then your supraclavicular. And I'm not palpating any enlarged or swollen lymph nodes, any tenderness in any of them?
No.
No? Okay, very good. So I've done your neck. Now I'm going to move on to your cardiovascular system. Let me feel your carotid pulses. Okay. They're nice and strong, even on both sides. I'm going to also take them with my stethoscope, the bell of my stethoscope, to see if there's any bruits. Good job holding your breath on here. Okay, I'm not hearing any bruits, which is good. Now I'm going to move on to your cardiovascular system. I'm going to listen to some different areas of your heart. I'm going to start at the second intercostal space, right sternal border. This is the aortic area. Hearing S1 and S2. Come over to the pulmonic area right across. Okay. Now the third intercostal space. The fourth. And the fifth. This here is the tricuspid area. I'm going to move straight across here. Listen to the mitral area at the midclavicular line. Okay, and I'm just hearing S1 and S2. No clicks or murmurs, rubs, anything like that. Now I'm going to listen to all the same areas with the bell of my stethoscope to see if there's any differences. Once again, no murmurs, rubs, clicks, anything like that. So that's good. Now I'm going to listen to your breath sounds, okay? So every time I move the stethoscope, I need you to take a nice deep breath for me. Sounds good, nice clear lung sounds. Now I'm going to listen to your sides, so if you can take this hand and place it on your head. Deep breath. Okay, now opposite hand. All right, very good. Now I'm going to ask you to turn around and I'm going to listen on the back of your chest. Deep breath. Very good. Once again, clear lung sounds. I'm going to percuss here for resonance. Okay, and I just kind of felt some resonance throughout. No areas of dullness or hyperresonance, which is normal. Now we're going to do a test for tactile fremitus. Anytime you feel my hands placed on your back, I need you to say 9-9.
99, 99, 99, 99, 99.
Okay, and that felt equal throughout. No areas of increased or decreased vibrations were felt. Now, I think that's all. Or one more test actually. Let me place my hands on your chest and take a nice deep breath for me. Okay, and my thumbs and hands move symmetrically apart, indicating equal chest expansion, which is normal. So I think we're done with the respiratory system. If you want to lay long ways on this table here and kind of prop yourself back on your elbows. Very good. She's about 45 degrees. You can turn your head and look that way. I'm looking for any jugular venous distension. And I don't see it on her, which is totally normal. Okay, thank you. Now if you want to lay all the way down.
Okay.
While she's laying here, I'm going to try to palpate for her area, her proximal, or her PMI, point of maximal impulse, which is where you feel the apical pulse. So I'm going to go to the fifth intercostal space, midclavicular line. And I can feel her pulse. And if I was having trouble feeling it, I could always ask her to lean on her left side, because it will displace the heart just a little bit. Alrighty, now from here I'm going to feel the rest of your pulses, your radials. Okay, your brachials. Both equal, strong, and symmetrical. I'm going to check her capillary refill. It's nice and brisk. Both sides, her arms are warm. Now I'm going to feel for her femoral pulse. Okay. All right, while I'm here, I'm going to palpate for any lymph nodes. And I don't feel any, which is fine. I'm going to palpate her popliteal pulses. And they're equal. Her dorsalis pedis pulses. They're equal. And posterior tibial pulses. They're strong and equal. Capillary refill of her toes. Nice and brisk. Not noticing any areas of swelling or redness. All right, Miss Katie, if you want to sit up for me.
Okay.
And that concludes your assessment. Thank you very much.
All right, thank you.
You're welcome.